Alright, this instrument is known as the G11-12. It's a debridement instrument, and it's specifically known as a curette. It has a complex shank. So if we look at the shank, see how there's bends in it? That means that it's complex. It's moderately flexible, meaning that it's used to remove light to moderate calculus. It's double-ended and paired, meaning that both ends of the instrument resemble one another and can be utilized in the mouth. It has a semicircular cross-section with a rounded toe end, meaning that it can be used subgingivally to remove subgingival deposits. It has a 70-degree angle from its face to terminal shank, and one usable cutting edge per working end. And we always want to use the lower cutting edge. This instrument is utilized in the posterior region on all supra and subgingival surfaces. It's adapted at the distal line angle to the mesial interproximal space. So what that means is that we're going to adapt our instrument at the distal line angle and work all the way to the mesial line angle, making sure that once we go inside the mesial line angle, we're parallel with the long axis of the tooth. So see how the working end is straight with the long axis of the tooth? See how they're both parallel? If we were to use this working end, other side of the instrument, we would no longer be parallel. I know it's kind of hard to see and it's blurry, but we always want to be parallel with the long axis of the tooth. Parallel, parallel, parallel. A little trick to help you remember which working end to use whenever you're utilizing the 11-12 is you always want the bump of the instrument in towards the tooth. So if you look at the instrument, see how there's a little bump right here on this side? We always want the bump touching the tooth, towards the tooth. If the bump is away from the tooth, we can automatically assume that's the wrong working end, because once we put it interproximally, the terminal shank will not be parallel with the long axis of the tooth. So 11-12, remember, 11-12, bump in, and will always be parallel. Now let's see this instrument used clinically.
Mandibular posterior away, and then be seated at approximately the 11 o'clock seating zone. And the instrument is going to go from distal line angle to distal interproximal. maxillary toward surfaces, you're going to sit at the 9 o'clock zone, straddling the chair, palm up. Starting at the distal line angle and working into the mesial interproximal. Maybe palm up. The back of your fulcrum finger would be directed towards the patient's commissure. And as you rotate around the line angle to come into the interproximal, you want to make sure that the terminal shank stays parallel with the long axis of the tooth. Maxillary away surfaces. You're going to be seated approximately 11 o'clock using indirect vision. As you're working on away surfaces, you'll have the patient turn towards you.